All right, good afternoon, everybody. Here with Josh and Paul. And somebody I want to mention, Mary Sue. She's been doing the signing here, and I was reminded that yesterday was Interpreter Day, Interpreter Appreciation Day. So, Mary Sue, thank you for what you're doing and wondering how you sign that. And we're here with our friends, Indra Nooyi and Dr. Albert Ko. They've just spent a fair amount of time briefing our legislative leaders, and now they're back ready to take your questions as we move towards May 20th, the pinnacles of scientific and business success, now learning the ways of government. Welcome, both of you. Let me just give you a short tee-off to those questions. Our COVID Daily Summary, I think we're back on track in this sense. Our hospitalization is down again. That's good. We were worried a little bit, and that's a trend that I hope we're able to count on. Just as importantly, our testing continues to ramp up, 4,700. That's going to be a little lumpy. And very important is that the number of positive tests as a percentage of the tests performed is down. It's about 17%. And that's counterbalanced by another 79 deaths of our friends here in the Connecticut family. The day-to-day change in hospitalizations, you can see in the next chart, just continues. We're now, I think, at 16 plus days of that continuing 3-day downward trend. As you know, that was an important criterion for our reopening. And let me just move into our criteria for reopening, why we're oriented towards May 20th. We might go to the next slide, Max, and walk this through for you a little bit. We're going to go through each of these 7 criteria and give you our best estimate of where we are. I want you to know that as we talk about today, the criteria for reopening, what's on May 20th, tomorrow David Lehman and our team will be there, having met with the association, having met with OSHA, having met with the labor leaders, putting together a safe set of protocols for reopening business by business. We'll get that started tomorrow. But while we have the best scientists in the world, and Dr. Ko put together an amazing team, it's still a matter of judgment in terms of how we open and what are those criteria and what are those protocols. And it's an art as well as a science. And we have to balance risk here. I think we've got it right, and that's why we're trying our best to explain what we're trying to do every step of the way. So criterion number 1 is 14 days of decline in our hospitalizations. And now we're down about 30% from the peak in terms of hospitalizations. And you can see Josh has put together a nice little status for you over there. So far, based upon this criteria, we get an A+. We're in the green there. How do we look at these regional outbreaks? Well, as you know, we've got 11,000 of the smart thermometers out there. We have 60,000 people on How We Feel, the app. I want more of you to do that. Other ways that we're able to get a test of what's going on in the greater region as we worry about potential flare-ups as we go forward. And of course, testing, which we'll talk about in some detail. Criteria number 2 is testing. And as you can see, we've ramped up our testing quite a bit. We're close to 5,000 yesterday. But we want to get up to 42,000 COVID diagnostic tests per week. That's our goal over the next 2 weeks. And so that means on average, we want to double the amount of testing we're doing right now. And you know, this is why it's so important, and we're not taking our eye off that goal. All symptomatic patients should be tested. They should be tested on a regular basis. And just as importantly, we want to start testing asymptomatic patients. So we're not just reliant upon the app and the thermometers. We get a better sense of what infections look like, community spread in the greater community. We want a faster turnaround, and I think you've heard from our partners at Quest and Abbott, we were getting that faster turnaround. So we're not waiting 5 or 6 days for the test results to come back from a lab in California. And I think we're making super progress on that as well. We have to continue to work with our labs to make sure we up our capacity to do the testing analysis. And There, I'm really pleased to say that we're getting good success from our local partners. And our friend Kevin Lembo, the controller of the state of Connecticut, and also formerly the healthcare advocate, is hoping to take the lead as we finalize those negotiations with those labs to make sure they have the wherewithal and the capacity to make sure that we can measure up to those 42,000 tests per week. And finally, as you've heard from Josh and myself, we have good, strong corporate relationships with the key suppliers. You know, be it the swabs, be it the reagents, all the different pieces. We think we are nailing down that on a contractual basis. So over the next 2 weeks and over the next 2 months, we continue to ramp this up the way we said was so important. So while it's still a little yellowy there in terms of status, I think you're going to see real progress on our testing capacity and implementation over the next 2 weeks and over the next 6 weeks. Next slide, please. We've talked a lot about contact tracing and what that means and how that allows us to, once we've found somebody has tested positive for COVID, to find out who they've been in contact with so we can continue to reduce the spread of this virus. And as of today, late today, our Microsoft platform goes live. And we'll be testing that out over the day or so. But that means that once you test positive and we get notice from our local Department of Public Health, that information is kept within a very closed loop. That person will get a text. That person will say, we understand you have tested positive for COVID. If you're willing, could we have one of our contact tracers give you a call, find out who you've been in contact with? Otherwise, would you mind filling out this form that tells us who of your friends or who you've been in contact with we can notify so they in turn can be tested or quarantined going forward. And I think this is one of the ways that we'll be able to ramp up the human element aligned with the technology. We have hundreds of volunteers already ramping this up, working through our amazing schools of public health, led down in New Haven right now. And we're going to be able to get up to 700 of these contact tracers very soon. And Kristen Soto, I think you remember, she has appeared on one of our weekly briefings here, and she's taken the lead there. She's been doing the contact tracing for some time in our Department of Public Health. It's a time-honored in terms of measles and mumps and other places. Obviously, this is a much higher factor. I think we're off to a good start there. We have a way to go, so that's still in yellow, but you're going to see a big difference over the next 2 weeks and over the next month. The next criteria number 4, I cannot overemphasize how important it is to focus on our vulnerable and high-risk populations. It's the right thing to do, as I've said before, and it's the smart thing to do. And we know the complications and the fatalities in these vulnerable populations. And we also know that it's those most congested areas where you can have flare-ups and the potential for a resurgence of COVID. So this is why it's really important that we continue to focus on our nursing homes. You know what we're doing in terms of all the physical inspections. You know that we are now going out and testing everybody at the nursing homes, focusing on the first responders, focusing on symptomatic individuals, and then getting to everybody. The direct care workers like correction staff and first responders are going to be important in the same way. These are folks who put themselves at risk every day. We owe them the very best we can to make sure they are safe and the people they're treating are safe. And the at-risk urban communities, I can't tell you how important that is. And those folks who live in the most congested areas, those folks maybe have many people to a home. Those folks often the urban centers, they're also the ones most likely to get infected, most likely to suffer complications, most likely to find a flare-up there. And we have a lot of testing capacity right now, but we have to do a better job of taking the test to these folks and making sure they realize how important it is they get tested. We've gone from 2 to 3 mobile vans right now, mobile testing vans. And this is going to be very important in terms of how we make sure all of our people are safe, all of our communities are safe, and if they're safe, the greater community is safe as well. I was just told by Paul about we got a federal grant. I think it's about $7.5 million, so we can roll out testing in our federally qualified health centers, which tend to be in the more disadvantaged communities. And in a minute, we'll tell you a little bit more about what we're doing to make sure pharmacies can also implement more of the testing, at least the collection. So we're taking the testing and the collection to you. And by the way, for this community, you don't need a doctor's permission anymore, a slip. We want you to get tested. I think it's the best interest of your health, your family's health, and your community's health. We'll be issuing an executive order on that today. Criteria number 5. This is adequate healthcare capacity. This is why for all of us, we look at the declining hospitalizations as really important. Dr. Ko reminds me all the time we have a very thin margin for error here. And if we have a flare-up like you saw in the previous slide, nursing homes, distressed communities, our hospitals can be, you saw what happened in places like Italy and Queens, and we're not going to let that ever happen in Connecticut. So we monitor that capacity, and we make sure that we have, right now we have about 40% of our capacity, which is good. If we get closer to 20%, we rethink some of our openings and some of our priorities. But I want to give you the opposite message as well. I was just at St. Francis today honoring our nurses, and people are waiting before they go to the hospitals, waiting until they get increasingly sick. And that's dangerous for them and their community as well. So just like we have capacity in testing, and I want you to get tested, symptomatic in particular, or even asymptomatic down at Abbott Labs in New Haven. I also want you to know that we want you to go to the hospital, talk to your doctor if you feel at some risk there, because people are waiting, and I think they're waiting too long, and we do have the capacity for you right now. The next criteria for opening, criteria number 6, a 30-day supply of PPE. That's masks, that's gloves, that's face coverings. As you know, we've been just-in-time inventory for the last 6 weeks, 2 months. But I also want you to know that the supplies are coming in. We got supply and demand are beginning to match up. We're going to have surprisingly positive news for you on Saturday in terms of the amount of PPE we're going to be able to get to give us confidence that we have the capacity to open those small businesses and those outside restaurants and make sure that those small businesses have the masks and the gloves they need to keep safe. And the supply chain is stabilizing. That's what I mean by supply and demand. So while that is still in the, what is that, yellow, light green, I think you can see that green by the end of Saturday. Finally, criteria number 7. This is the standards and regulations we have for reopening. And this is really what we're going to start rolling out to you tomorrow. So you store owners and outside restaurants and salons, you have a couple of weeks to prepare, and if that's not time, don't open up. May 20th is just a date that you can open it up, not a day that you should open up until you're ready. I want you to know that David Lamont and his team, working under Indra's guidance, are working very closely with different industry associations to make sure the restaurants and the retail and the factories, the other groups are there giving us their best guidance on how they can provide for their customers and employees safely. We're working in close collaboration with labor as well to make sure that their employees on the front lines know that they're safe. We're working closely with OSHA, Occupational Safety and Health. So we put together these protocols, if you will, in a way that I think is clear to understand. We've walked them through with the legislature, a little more time for some back and forth. We're going to start unwinding those for you tomorrow with Layman and the team so you get a better idea of what you can plan for if you're ready to open on May 20th. I think with that, you can see in this final chart sort of where we think we are in terms of our criteria for opening. I don't think we're going to have an A+ in every category, but I certainly want to be in the A's and to make sure that you have confidence and that Albert, Ko and Indra Nooyi have given you some sense of how we think about this, why we made this judgment, why we think this is the right decision for Connecticut, first from a public health point of view, and then in terms of your livelihoods. With that, Max, I'm happy to take any questions. Indra Nooyi, Albert, Ko, Josh, Paul, we're ready for you.
We'll start with the Day of New London.
Good afternoon, Governor. Karen from the Day. It sounds like tomorrow you'll be giving the towns and municipalities more clarity on the outdoor dining. Will that include waiving local zoning regulations and allowing businesses that don't ordinarily have liquor permits for outside to perhaps get them?
Yeah, my understanding is that we're going to have an executive order on that in terms of what we can do to make it easier for restaurants to, serve outside a meal and a drink if they want. And we're working with the local municipalities who have a lot more authority over the local municipal zoning, and they will have the green light there. My preference is to open it up, allow more of those tables to go outside, maybe even into some of the parking areas or more of the sidewalks. To make this something that brings your city to life and do it safely.
Thank you. And one more question. Is there any tentative date now being talked about for reopening the tribal casinos? And will that be influenced by what our neighboring states do with their gaming facilities?
It will be. I think all the casinos around the country are in conversations right now. Paul and I had a good conversation with Mohegans and Pequots just the other day, thinking about how we can do this safely. I don't see this on May 20th, but we are working collaboratively on this.
CT News Junkie.
Thanks, Max. My first question is for Josh. Josh, what's the current situation with PPE? There on Friday when we spoke, it was 62 million in outstanding orders. Have those been fulfilled? And I'm hearing from a nonprofit group home that they've only received 50 and 95 masks, and they have 1,700 employees.
So on the second question, if we've been fulfilling dozens and dozens of orders every day through our mutual aid programs for partners, direct care providers who have needs. So if there's a particular issue at a site, they need to bring that up through the state agency that is responsible for them, and then we're fulfilling orders where the need exists. Generally speaking, we're now up to about 50% of our orders that have been placed since the beginning of the pandemic have been fulfilled, and we expect about 30% to be fulfilled within the next week and a half. But even as the remaining 50% comes in, as the governor alluded to earlier, we're getting increasingly well fortified in our state warehouse. And as the governor alluded to, we're expecting one particularly large delivery this weekend. So we are in very good shape from a PPE perspective at this point.
Okay, so contact the state agency that they report to and have them get the masks that they need?
Correct. They put in a request through our mutual aid program, and we help support them through that.
Okay, and I guess this question is for the governor or Dr. Ko. The White House criteria suggests that states should have a downward trajectory of either documented cases or the percentage of positive tests. Since the number of cases isn't going down, are we using the percentages, and what do we need the testing to be at?
So I guess I'll answer that question. Probably the best metric, for looking at we're going in the right directions is, as the governor had explained, is hospitalizations. One of the problems with respect to hospitalizations, as you can say, as the governor had just shown, we have a 16-day continuous decline. So that's all good news. The problem with evaluating the cases is that as you ramp up testing, you're testing more people, you're identifying more people, even though the transmission in the community may be lower. So for that reason, for this metric, at least for this first reopening, the best metric is just seeing how the hospitalizations are going down. I think the metric was the positive tests. And as was mentioned before, we're about at 17%. So if we're going to give 100 tests out at this date, about 17% are positive. The number we really want to get to is about 10%. And that's the whole importance of trying to roll out testing so that enough people are testing, that more people are tested than are actually positive, so we can make sure that we capture everybody. And we're heading that direction. But I think, again, the most important criteria is the hospitalizations, because that gives us a window on what happened in the infections in the community.
Move along next to the Waterbury Republican American.
Hey, I'm going to have a couple of questions here. Governor, wasn't clear on your initial answer regarding local zoning. Will your executive order supersede local zoning to allow restaurants to set up outdoor seating on parking lots and sidewalks?
My understanding is that would be subject to local zoning. I think they have authority over that, but we're doing everything we can to open up in terms of what they can serve, alcohol and the such. Paul, do you want to jump in on that?
Yeah, I'll jump in on that. We've been working directly with the local municipalities, CCM, costs as it deals with this issue. We should be issuing an executive order in short time on this matter. One of the things that we have been doing on all of our executive orders that have an effect on the municipalities is working directly with the municipalities. So we're happy to be working with them on that issue and through our legal team, and we expect to have an executive order that will have full clarity on the zoning issue in short time.
I've got a reader question. The readers want to know, are state employees receiving their full salary? So perhaps you guys could explain how state employees are getting paid at this point.
Yeah, they're receiving their full salary.
In terms of if they're not able to get to work, I mean, that.
Look, everybody is working. Some frontline workers have to go to the office. They're dealing, they're first responders, corrections. Others are telecommuting, DRS, DMV, still working. Everybody is still required to do the work they're expected to do.
When do you expect to bring back teleworking employees? If May 20th is a reopening day for businesses, when should state employees be going back to their regular workplaces?
Well, as the governor mentioned, I think last week when we rolled out the phase 1 activities, we're still encouraging all employees who can work from home to continue working from home for the foreseeable future to help reduce the risk. We actually had an all commissioners meeting earlier today. We were discussing any services that we provide that we've had to discontinue because people have been working from home, and looking selectively, consistent with the overall guidance for phase 1 around looking to start to reopen businesses where necessary, about certain activities we may look to reactivate, but those are preliminary discussions right now where we're looking to balance the services that we provide and how critical those are and the ability to delay those or not delay those versus the public health risk, because we're still primarily focused on that public health risk at this point.
Well, what sort of services are you talking about?
Well, as I just said, there's a preliminary discussion today. Each commissioner is doing their own analysis, so when we have more news to share on that, we will.
And Governor, do you have any more news to share on the request to expand workers' compensation cover to essential workers?
I think we're going to be giving some guidance on that very soon.
Okay, thank you very much.
Move along next to Boceto Media. WTIC 1080 News.
Good afternoon. For Indra, we heard from grade schools on Tuesday. We heard from the colleges yesterday about backup plans, and everyone seems to be very serious about concern that this could all backslide this fall. Where's your concern level on that?
Indra, do you want to take that?
Yeah, I didn't hear the question clearly because it was breaking up. Can you just...
Let me try it, Indra. I can just tell you, the question was really about our backup plans, both with K through 12 and college. If we find ourselves in June and July, we see another flare-up, we see a resurgence, we gave advice to our schools. What is your backup plan? Colleges, how do you distance learn? That was the question.
So both Commissioner Cardona and the colleges and universities are developing their individual plans. All have a backup plan for online learning in the event there is a outbreak again. And this plan can be triggered up to 2 weeks before the announced opening date of a school or college or a university. And so even this afternoon when I got off the phone with somebody, they said that if they're going to open, let's say the day after Labor Day, 2 weeks before that, if there's an outbreak, they can actually reverse and go to online teaching. So they're developing both plans side by side. That's the world we live in today.
And should folks expect the virus to be on campus? Linda Lorimer said yesterday that it's really inevitable that some students are going to get it when they come after they come back.
And that's why they talked about testing, and more testing of the students. Because when you have residential halls and everybody's in such close contact, we have to up the testing, we have to increase the contact tracing, and we've got to have the ability to isolate those that exhibit the symptoms and those who came into contact with them. So it's a very deliberate plan. Think of the colleges and universities plan as a microcosm of the state. So we're just going to have to do that in a college environment regularly.
Move along next to CTN Vivo.
Thank you, Max. This is Oscar with CTN Vivo. So, Governor, I have a question about the Department of Labor. The call centers, seem to be closed or not working over the phone. People have been applying to, receive employment benefits. If people is not receiving or not getting any information from them, are you thinking, or when are you thinking to have the call center back again and people can communicate over the phone with the DOL?
Well, I'll start with this. The call center is open. It's overwhelmed by calls. That said, we have, I think, paid over 90% of the regular unemployment claims. The $600 supplemental coming from the feds has been delivered as well. My understanding is that for those self-employed, reapply, that is now functional, able to get to you. We got most of the backlog taken care of for the general, and for the self-employed, we're going to have that taken care of very soon.
Okay, Governor, I think you mentioned this, but I think I didn't hear if you can clarify on this. So people that feel the symptoms of the coronavirus and need to be tested, and they don't have a doctor, to refer, how is people going to be able to get tested without the doctor's note?
The answer to that is yes. Abbott Labs, New Haven, you've got it. The federally qualified health centers, you've got it. If you have a doctor's note, even better. But we're going to take care of you. We want you to get tested.
And I'll also add that we have additional capacity at the CVS Abbott Lab site in New Haven. We ask all Connecticut residents to go to that site to get tested. We want to make sure that we get all of our Connecticut residents who need to be tested.
And Paul, that includes the people that do not have insurance? Health insurance?
Correct.
Okay, thank you.
Move along next to Fox 61.
When do you expect to release daily hospital discharges?
So that's actually in our metrics package we're releasing tonight.
Yeah.
Perfect. And then you mentioned guidelines that businesses and restaurants will have to adopt within the next 2 weeks before opening on May 20th. What are some of those specific guidelines besides social distancing and, say, wearing a face mask?
Well, for the restaurants, as you know, outside only. Tables are going to be 6 feet apart. Somebody's bouncing off there. What are some of the other guidelines?
Yeah, so some of the other guidelines is it deals with appropriate PPP, into making sure that you have those right guidance. In addition, it's also guidance that's also going to be protective of not only the employers but also the employees. If you're going into retail areas, making sure that you're wearing the appropriate face mask. So it's going to be a very well-developed guidance, as Indra and Dr. Ko stated, working with some of the brightest and top minds that we have, especially on the OSHA side. And I may say these are guidelines that our fellow states around us have very much have looked at and are very much eager to replicate as well.
And we work closely with the restaurants in developing these guidelines as well.
Mm-hmm. And then after yesterday's news briefing, we had a number of people reach out to us asking about tuition. Will college students see a decrease in tuition if their learning switches from in-person classroom learning to online learning come fall?
That's going to be obviously up to the different colleges. I know, for example, University of Connecticut, they've waived all room and board expenses, but the education continues, the online learning continues, and I think there is tuition attached to that, yes.
Move along next to Channel 3 Eyewitness News.
Yes, Governor, taking a broad overview of where we stand, you went step by step through the criteria, and that was very helpful. But we see that a lot of it is still in yellow. Are we confident that we're going to get all of these metrics to green in a week and a half? And do they all need to be green in order for us to open on the 20th?
We got to get close to A+. I want to see our metrics get into the green zone. Look, if we're a little off on one or two, we'll make a judgment on that. But I feel very confident that we're moving in the right direction. May 20th is a good date. These are the 7 criteria that, Indra and Albert laid out, probably a few weeks ago now, and I think we're keeping to them.
And on a positive note, the hospital capacity has been achieved. Do we know if we've even needed to use some of the overflow spaces, particularly at the Connecticut Convention Center and Southern Connecticut State?
A few of these, including St. Francis and the Convention Center, are being taken down at this point because we didn't need it. We needed it down in Stamford and some other locations, by the way. And also, we're ready to go. If we find there's a flare-up later this fall in the flu season or people relax on social distancing, we can get this set up again pretty fast. We found out you can do it in about 2 days.
News 8.
So the CVS testing in New Haven has been working very well. We've been hearing a lot of reports about that. Is there any indication how many tests are coming out of there a day, and are you going to expand it up maybe to Hartford or to the east or western part of the state?
Yeah, so we've been seeing around 300 or 400 tests a day coming out of CVS. So there's as Paul said before, there's significant capacity there. I was actually on their website this morning, and there were appointments available all day. So as the governor said, if you're symptomatic, if you have any of the symptoms of COVID, please go to that site and get tested. It's probably less than an hour drive for 80% of the people in this state. But to your point, we're opening up a lot of other sites as well. The governor alluded to some of the other partnerships that we're working on with our federal health centers and our communities, mobile testing facilities. So we're doing a tremendous amount of work right now to increase the opportunities for people to get tested, going closer to them and into their communities.
And as far as the marketing plan, we had heard, do you have any updates on where the other states are that you've been keeping track of that have opened? How many people are returning back, and what kind of a marketing plan you could look at?
I'm not positive about that, but I tell you what I do believe. I believe I got to do a better job in terms of public health and education to remind people that we have capacity. We want you to get tested. It's in your interest, your family's interest. If you're feeling ill and it may be complications, go to the hospital. Don't wait. I mean, that's one of the first things I can do to get more testing going now.
I'm sorry, I was unclear in the question. For businesses reopening, for restaurants, do we look around at like Georgia? And I switched without telling you businesses, my bad.
Oh,
so what are you looking at as far as a marketing plan to tell people we're open, it's safe, come back, and how has it been going in the other states like Georgia?
So maybe I can take this.
Take that, would you?
I think in the suburban areas, the restaurant traffic is a bit slow. In downtown areas with a lot of young people, restaurants are more packed than they should be in many states. What we have in Connecticut is just outdoor dining, and we have a very specific plan through digital media that we're going to start very soon to start giving people some comfort that it's okay to go to these restaurants and sit outside and enjoy a meal. Now, I want to be clear. It's going to take a while for people to get comfortable, to see the face masks, to see how these tables are set, and the fact there's going to be disposable menus. The waiters are going to have gloves. It's going to take some getting used to. It's a new way of life. But our hope is that over 2, 3, 4 weeks after May 20th, people will start to get a little bit more comfortable and life will start getting to normal. Remember, we used a very critical word in the last week's press conference on this topic. We're taking baby steps to start getting businesses ready and consumers comfortable with frequenting these businesses, whether it's retail or restaurants. So this is going to be a slow process. The marketing program will continue, and we're going to keep giving consumers confidence that they can go back, and we worry about their health as much as we can.
Let me just follow up on what Indra said so well. If the customers don't have confidence, we can open and nobody will go. And that's why these protocols are so important. That's why we have tens of thousands of fever meters that we're going to be able to make available to some of these businesses where you could be in contact. That's why we're going to have masks available for folks. That's why Electric Boat, for example, they are now going to be testing each and every one of their employees before they go to the plant floor. That's a PCR test as well as an antibody test. They're starting that today or tomorrow. Employers and proprietors all want to make sure their customers and employees are safe and feel safe.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Just going back to the criteria, which one of those, or maybe are there several right now that you're especially concerned about whether or not the state will actually meet that by May 20th? And is there anything that we're doing to make sure that we meet those?
Yeah, I was very concerned about PPE up until maybe a couple of weeks ago. Everybody had promised the orders were arriving, and I was from the Show Me State. They are now arriving. I feel much more confident on that. I feel very confident on hospitalizations, which for Dr. Ko and myself are a key metric. I suppose we have great corporate relationships, good lab relationships. When it comes to the testing, I feel like we're going to get the capacity up there. Whether I make sure that everybody is actually getting tested, that's something we're going to have to work on.
And I just know that the federal task force, specifically Dr. Birx, had raised some concerns about some businesses, nail salons, hair salons, barbershops being involved in phase one. Does the Connecticut task force have a similar concern? Because right now they are involved with phase one.
Well, I'll start and then hand it to the task force. Look, I had some concerns. These are places where social distancing does not come, it's not as obvious. And yet we talked to an awful lot of proprietors, we talked to an awful lot of customers, how important it was that on a very limited, very strict basis, we see if we can get this going, as Indra said, with baby steps. So you're going to see the protocols in the nail salons in terms of the number of chairs that can be there, perhaps plastic in between those chairs, the nature of the masks and the protection we need, by appointment only. We're going to take baby steps as we get here and see if we can make this work.
It's exactly right, Governor. I think the wonderful thing about nail salons and hair salons is that they're a source of employment, large source of employment. But we can't turn on a switch and say, let's open everything. So what we're doing is saying, let's put in very strict hygiene conditions. Let's test our way through this so that as the summer goes on, we know how to titrate what we need to do. So when we have to open fully, we know all the steps we have to take. So the hygiene conditions we're putting in are very stringent. You'll see that when the protocols come out. And we want to worry about the safety of the person who's cutting the hair or doing the nails, as well as the consumer. Our protocols worry about both.
News 12 Connecticut.
Governor Lamont, we're expecting historic unemployment numbers tomorrow morning from the federal government. What would you say right now to everyone in the state that is currently unemployed?
I'd say that we have a strong economy that was knocked off its kilter by a COVID pandemic. That if we get this health right, if we do this on a deliberate way, we're going to be coming back, your job's going to be coming back, and our economy will be coming back perhaps even stronger for a state like Connecticut. I'd say I know the hell you're going through. You know, I always tell you what it meant to me being at Rensselaer Field and seeing everybody lined up trying to get their 15 pounds of food. And these were folks who had a good paying job just 6 weeks ago, and now they're waiting in line 2 hours in a car to see if they can get enough food to feed their family for the rest of the week. I think we understand the pain and the risks and the anxiety that people are going through, but I am optimistic that we're doing this right and that we're going to get you back working as soon as we can safely.
The Associated Press.
Good afternoon, everyone. I was wondering if someone could please sort of clarify the protocols for testing at nursing homes currently and going forward.
Sure. So we have been constrained since the beginning of this pandemic by test kits and supplies, and more recently we've started to get more supplies. We've been able to increase the amount of testing we've been doing, and as recently as this past weekend, we're now sending teams into our nursing homes to test everyone, whether they're symptomatic or asymptomatic. So we've had 6 nursing homes we went into last week. The teams have been out every day this week. So we're dramatically increasing the amount of testing in nursing homes as supplies have become more available, with support from our National Guardsmen and our Department of Public Health, and some assistance we've had in the state from CDC resources as well.
Will they be tested frequently? Is it just a one-time thing? And also, Josh, are you seeing any kind of trends in any kind of order violations against some of these nursing homes?
Yeah, so it will be repetitive. You know, we'll try to strategically focus the testing on areas where the public health team identifies the most risk, or if we see flare-ups in a certain area. So that will be ongoing and is a key part of our testing strategy going forward that Dr. Ko and others have helped develop, really focusing on those most vulnerable populations.
And have you seen any kind of trends in any violations that have been reported at the nursing homes?
Yeah, you know, they've reported it's not widespread. Mostly the inspections have been positive. The nursing homes overall are doing an incredible job under exceptionally difficult circumstances. Some findings around donning and doffing of PPE, just training, infection control procedures. But, you know, I would just reiterate also, we're going to be putting out our weekly nursing home report today, and one thing we're excited about is starting next week, we're going to start publishing nursing home recoveries as well, because those are really starting to pile up all the good news stories that represent the hard work of our nursing home frontline nurses and staff and getting people back to health.
Thank you very much.
The Hartford Courant.
Yes, Governor, I'm interested in the goal that you talked about the 42,000 tests per week by May 20th. I think you might have said that's an ambitious goal. What happens if you do not reach that goal? Would you push back the May 20th reopening date?
Well, it's a package of criteria that we have, so I look at the entire package. Testing, though, is very important. And like the difference between 42 and 40 and 44, Dr. Ko can explain to me, but we're gunning to get the 42,000 tests. I think we're over halfway there now, and Josh and I feel pretty confident that we got the lab space and the ingredients we need.
Maybe I can just...
Dr. Ko, go ahead.
Yeah, maybe I can just expound on what the governor said. So I think, you know, the absolute number is not the important thing. It's what you do with those tests that is important. And as Josh had mentioned previously, those tests need to do several types of things. They need to protect our vulnerable, and the most vulnerable in this population are those in the nursing homes. So that's one of the major, priorities for the next, up to that May 20th date, is to roll out in those nursing homes to test not only the residents but the workers. Because they'll both have to be protected in order to prevent the outbreaks that we've had in the past. The second part is that we are testing all, as the governor mentioned before, testing people who are symptomatic, because that's the way we're going to be able to detect if we're going to have another resurgence. So it's not the exact number, whether it's 41 or 40 or 43. That's important. What's important is how we use those tests.
Okay, also, on the economic front, I want to ask the governor and Indra, a lot of the non-essential retailers, as you know, have been hit particularly hard. We're told that Nordstrom's could be closing in the West Farms Mall, and Lord & Taylor and J. Crew are at risk in the same mall. With so many jobs in retail, how do you, Governor, envision the future of shopping malls and retail in Connecticut?
Well, I'm going to punt this over to Indra very fast. But I think what you're going to find is the consumer will be going back to the traditional retail. Obviously, the online retail is going to get a big kick out of what's happened here in terms of money. We are taxing internet sales transaction, which is helping our tax revenues. I think there'll be a place for retail. I know there's going to be a place for malls going forward. How it changes over the next few years, Indra will explain to me.
No, I think, going to a mall or to a retail store was as much the experience of actually getting out of the house and walking around and experiencing things as it was actually buying the stuff. So what we took away from the consumer as part of COVID was that experience, because we asked them to shelter in place and we shut everything down. And people are dying to get out and enjoy the outdoors and shop as they go along. And malls are an important part of that whole experience. So I think over the next few months and years, what you'll see is retail coming back, all kinds of retail. Malls are going to come back. But until COVID disappears, you're not going to find the congregation activities in a mall, the food courts, having lots of people, big families interacting with each other, hugging each other, something I miss incredibly. All of that is not going to be there until we have a vaccine and everybody feels comfortable going back to life the way it was. So I think you'll see increase in online. You'll still see people going to retail and to malls, but you're going to see a little bit more of a social distancing and less of a community activity in these malls, which is sad indeed, but it's going to take a while for that to come back.
Okay.
Connecticut Public Media.
Ali Rashofsky for WNPR. Have you decided how religious institutions might be able to reopen, and will they be included in that May 20th slow reopen of the state?
Yes, I was on with the religious leaders of all faiths again this afternoon. I sent them right over to you, Albert and Indra. But look, right now we have a limit of 50 people in these religious institutions. I encourage them for now, anything you can do outside is much safer. I said anybody over the age of 60 or 65, I want them to stay at home. These are really key criteria going forward. But they came forward with some very constructive suggestions they're going to talk through with the Reopen Committee in terms of how they think they might be able to reopen on a very limited basis. And again, that includes a lot of the protocols we're talking about for other small business.
And a final question, what about places like gyms? When will they be allowed to do a slow reopen? Is there any plan in place for how many people would be allowed in institutions like that?
I think the Reopen Committee convinced me that May 20th is too early for gyms. That even if you spread out the equipment, you clean it on a, after each and every person, this is something we need a little more time to make sure we got right.
Thank you.
Connecticut Mirror.
Thanks, Max. Hi, Governor. It's Keith. I wanted to ask you about the nonprofits. I heard Josh mention that they're trying to fulfill dozens of orders every day, wherever the need exists. I know that you got the nonprofits some of their money early in the second quarter of the calendar year. The problem is they're still saying that the PPE they're getting meets a tiny fraction of their needs. And I mean, these folks have been basically asking you for additional money since you took office. We've had a bridge loan program for businesses. We've deferred tax deadlines for households and businesses. We've expanded Medicaid eligibility to help low-income families. Do you see anything you can do in terms of direct financial relief for nonprofits, or are they simply on their own?
No, nobody's simply on their own, but you do the best you can on your own as well when it comes to PPE and other things. Look, you're right. We got money out to the not-for-profits faster and earlier to help them get the support they need going forward. We're working together with them in terms of 4CT or philanthropic group, providing contributions to the not-for-profits, private contributions, especially in the area of food security, to make sure they get some of the support they need. I think Deirdre Gifford is working very closely with the not-for-profits in terms of compensation to see how else we can be helpful for them. Look, they are key to everything we're trying to do, and the demand on many of them is never been higher.
Is there anything, though, specific you could pledge in terms of across-the-board assistance, or is that just premature?
If you're asking about a big increase in across-the-board financial assistance, I think that's premature. But I will tell you, we're working every day with the federal government, and the not-for-profits are front and center in our discussions there, because they should not be left behind. They are subject to the payroll protection program, and hopefully we're getting them closer to the front of the line. There is still money in PPP, the second round, and I hope our not-for-profits are taking advantage of that.
Thank you.
Hearst, Connecticut Media.
This one's for Josh. It's a variation on Christine and Keith. We've got some complaints from home health care aides who are working for DSS, and they're not being given PPEs unless they're symptomatic. Is this another case of going through the agency, as you said before?
Yes. Everyone who is in a role where PPE is necessary per CDC guidelines should have PPE. That's been true throughout. As the governor said, at points in this crisis, we've been very much real-time deliveries and having to conserve in some areas as there were shortages, but we have more than adequate supplies at this point, particularly of masks. One thing I've observed, though, is that oftentimes people will have an expectation about what level of PPE they should have, which is not in line with CDC guidelines. So there's an education component to this at times. I'm not saying that's what's going on in this particular case. We've just seen that at certain times that can lead to some of these concerns or questions that we have to educate people around.
Thanks. And Governor, I sat down with a restaurateur today who's deeply concerned about the lack of sustainability in the current plan for opening up. Dependent on weather, X number of seats outside, and he and other restaurateurs have developed lists of dozens of things they're willing to do to open up indoor dining. Do you and Indra have a ballpark calendar date that they could point at?
A calendar date for indoor dining, is that what you were asking there?
Yes, sir.
Let's see how it goes on the outdoor dining first. You want to harm your business, get people inside too quickly, don't do it on a safe basis. Something could turn people off on that. Make sure you get people back. I think the way the reopening committee is staged, it makes all the sense in the world to me. We're going to get people going back to restaurants. They're going to be outside. They're going to be in a safe environment. They're going to feel comfortable. And then with Dr. Ko and Indra and their amazing team step forward and say, this is working. We didn't see a spike. The restaurants are handling their protocols and taking it very seriously. Then we'll move to stage 2. I think that's a very appropriate way to go.
And finally, Governor, maybe Dr. Ko, on testing. So you're testing people who are symptomatic, but people are going to be going back to work who are asymptomatic, and if they're not spiking a fever, how are they going to be spotted if in the workplace if they're not tested beforehand?
Right. So you raise an important feature of COVID. So what we know from past epidemics is about 80% of the people who are infected actually never show symptoms, or maybe have just very mild symptoms. So just to understand why, the focus first on symptomatics, those are the people who are shedding the most virus. So we certainly don't want them to come in contact with people in the community to have transmission. But then, the work doesn't stop on May 20th with those 42,000. We're going to have to, continue the work, the hard work of, ramping up testing and actually expanding testing so we actually can screen people who are asymptomatic. And equally importantly, going back to what Josh said, that we have to protect the vulnerable. We need to use that testing so that we can prevent, for example, somebody who doesn't have symptoms go and works in the hospital, going into the hospital and spreading infection there, or someone working in nursing homes and being infected and actually infecting a very highly vulnerable population, people at risk for disease. So that's why, May 20th is an important mark. That gets us to a place where we can start detecting efficiently if we're going to have a resurgence. We have the benefit that we have social distancing, strong social distancing now, and we're going to be, as Indra has already said, taking those baby steps. But we're going to still have to work, and we're going to have to work in getting up that testing. We have to get people who want to get tested, and we're going to have to implement all the interventions that for quarantine and isolation, and that's going throughout. So this is not going to be a one-step deal.
Thank you.
I think that may be it. And I think, first of all, to Dr. Ko and the team of scientists you've put together, those who specialize in infectious disease, those who specialize in testing, those who are leading the way on therapies, the amazing number of people and the dozens and hundreds of hours you have put in. And Indra, the business folks you have that are taking the lead, labor, OSHA, all those, coordinating that, making them work together. On behalf of the people of Connecticut, I cannot thank each and every one of you enough. And I thank somebody else today. This is not only Interpreter Appreciation Day, but it's also Nurses Appreciation Day or Week. And that's because this is the 200th anniversary of Florence Nightingale. And so I had the occasion to be at St. Francis Hospital with all the nurses there who, the love they show for each and every one of the patients there, not to mention the professionalism that they bring into a very risky environment. And I just reminded them that I love history. And 200 years later, Florence Nightingale made her name treating troops in the Crimean War. And I just told the nurses 200 years later, I can't remember what the Crimean War was about, but I remember Florence Nightingale like yesterday, and each and every one of you are making the same type of difference in people's lives. Thank you, everybody. Thanks to you guys.